Hi, good morning.
Good morning. How are you doing?
I'm good, thank you. I am Percy. I will be your nurse practitioner student. I will be assessing your skin, hair, and nail today. But before that, I have two questions for you.
Sure.
Have you noticed any new mole, rash, or lesion that you are concerned that you want me to look at today?
No, none for the time being.
Have you noticed any change in color or pigmentation in your skin that you are very concerned?
No, I have not.
Okay, that's great. So I'm gonna wash my hands first before we start the assessment, okay?
Okay.
Okay, I already washed my hands. I'm gonna start first by inspecting your scalp.
Okay.
So when I'm inspecting your scalp, I'm gonna be noting the distribution, the quantity of your hair, and if there's any area of alopecia and any normal male pattern baldness.
Okay.
Okay, I can see that your hair is flat and looks healthy. But I just noted that you already have the normal male pattern, which is the one here in your hairline, and that's normal as we age it. And now I'm gonna use my hand to split your hair to check if there is any nits, dandruff. They're not visible, okay?
Okay.
Yours, your hair is smooth. There's no dandruff. There's no nits or any infestation. There's no rashes or any lesion. So there's no abnormal findings. Now I'm gonna check your head and neck. Okay? So I'm gonna be noting the skin color around your eyes, nose, and cheeks
Sure.
and chins, okay? Because there's no changes of color or any pigmentation. There's no cyanosis. There's no rashes or lesion. Now I'm gonna check your eyebrow, and I'm gonna use my thumb to run. Can you close your eyes?
Sure.
Okay, I can see too that the hair on your eyebrow and eyelashes are evenly distributed. There's no lumps or any cysts in your eyebrows, and now I'm gonna run it to your eyelids, okay?
Okay.
Okay, there's no lumps, there's no cysts, and I can see that there's no puffiness or any edema. Now can you open your eyes?
Mm-hmm.
I'm gonna check with your conjunctiva, okay? So can you open your eyes and look up? Okay, I can see here that your conjunctiva is pink and moist. That's good. There's no cyanosis. Your sclera is white. Okay. And I can see that your lips is pink. Would you open your mouth for me? So I can check your oral cavity. Okay. The oral cavity is pink and moist. Even your tongue is pink. Okay, there's no abnormal findings. That's good. Now I'm gonna check your chin or your mandible area, which is your jaw, to check if there is any lumps, okay, or any cysts that can be seen. Okay, so there's no lumps or cysts. There's no abnormal findings. Now I'm gonna check your neck. I'm gonna be noting with the color too. Okay, there's no changes in color or pigmentation. Okay, I'm gonna check with my hands too to check if there's a cyst or what.
Okay.
Okay, there's no lump or cyst or any palpable mass. There's no rashes or lesion too. Now I'm gonna check your ears. I'm inspecting for the color. There's no changes in color or pigmentation. There's no rashes or lesion cannot be seen. I'm gonna touch it too, okay? So I can check if there is any cysts or any lumps that are not visible, and I can check to the back of your ear.
Okay.
Okay, everything's good. There's no abnormal findings. Now you can open your eyes. You okay?
Yes.
Okay. Now I'm gonna check your upper back. Would you like to turn around? And I'm gonna be opening your gown too, okay?
Okay.
Okay, there's no changes of color or pigmentation. Your skin looks intact. There's no visible rashes or lesion. Now I'm gonna palpate, okay? I'm gonna palpate to check if there is any cysts or any lumps or palpable mass.
Okay.
Okay, there's no abnormal findings. Now you can back again. Now I'm gonna check with your two arms, but I'm gonna inspect it first with the collar. I'm gonna lift your gown.
Sure.
Okay. Your skin look intact. There's no changes of color or pigmentation. There's no rashes or lesion. Now I'm gonna check with the back of my hand to check for the temperature and for the texture, okay? Just put it like this. The hair in your arms are equally distributed, and your skin is smooth, warm and dry. There's no palpable cyst or mass. There's no scaling. Okay. Now I'm gonna check for the mobile and the turgor. I'm gonna pinch your hand to look like a tent. Okay, so it went back quickly. So there's no tenting. The mobile is good and the turgor is good. It's elastic. It means that you are really well hydrated. Now I'm gonna check your two hands. I'm gonna be noting for any changes for color or pigmentation. Okay. There's no cyanosis. There's no rashes or lesion. Your palms are warm and dry too. Now I'm gonna be checking for your nails. Now when I'm checking your nails, I will be noting for the color, which needs to be pink, which is your nail beds are really pinkish, so it's good. And then I will be noting for the shape too if there is clubbing or onychomycosis. So there's no clubbing. Capillary refill is less than 2 seconds, which is great. Then I'm gonna be checking for any rags or brittleness. Okay, your nail looks healthy.
Okay.
Now I'm gonna check for your chest and abdomen. Is it okay if okay? Okay, your hair in your chest are evenly distributed. There's no any changes in color or pigmentation. Now I'm gonna palpate, okay, to check for any lumps or mass. Okay, it's unremarkable. There's no lumps and everything is good. There's no abnormal findings. Now I'm gonna go down to check for your legs, for your lower legs and your feet, okay?
Alright.
Now I'm checking for your feet now. I'm gonna be noting for the color, so there's no changes of color or any pigmentation. The hair is equally distributed. There's no sign of venous insufficiency, which is those like bluish discoloration, so there's no cyanosis.
Okay.
Now I'm gonna palpate it and check with the back of my hands too for the temperature, okay?
Okay.
Okay, the skin is intact, feels smooth, and it's warm and dry. There's no rashes or lesion. Now I'm gonna check for the sole on your heel, okay? Okay, your heel is blanchable. For your feet, there's no changes of color or pigmentation. Now I'm gonna check for the toenails, okay?
Okay.
Okay, the color of the nails is pinkish. There's no brittleness, there's no rug. Capillary refill is less than 2 seconds. The shape of the nails is good. There's no clubbing or any onychomycosis. I'm gonna check in the between of your toes too, okay? Because sometimes there is some lesions or lumps there that cannot be seen. Okay, I'm checking with the in between toes now, and everything is good. There's no rashes or any lesion in between, so there's no abnormal finding. Okay.
Okay.
Okay, so I'm gonna wash my hands because I touched your feet, and then when I come back, if you can stand up for me so I can check the lower back, your
Okay.
gluteal area, and the back of your thigh. Okay.
Okay.
Okay, I already washed my hands.
Hmm.
Would you like to stand up for me? And can you turn around, sir? Okay. So I'm inspecting your back now. There's no changes of color or pigmentation. It's the same with the upper back. So there's no abnormal findings. I'm gonna check with your gluteal too. Gluteal area. Okay, it's the same. There's no changes of color or pigmentation. There's no rashes, lesion, or lumps. Now I'm gonna check at the back of your feet, okay? Of your thigh.
Okay.
Okay, just relax your foot like that. Okay. The hair is equally distributed at the back of your thigh. There's no color, there's no changes of color or pigmentation. Now I'm gonna palpate it, okay?
Okay.
Okay, there's no lumps. There's no rashes or lesions. Okay. You can sit up again.
Okay.
So I have concluded my assessment. Everything is great. So there's no abnormal findings. Do you have questions for me?
No, I don't. Thank you for your help. I appreciate it.
You're welcome. Okay, thank you. It was nice meeting you, and enjoy the rest of the day, okay?
All right. Thank you.